30. Here, Leicester West MP Liz Kendall is being tested by one of the city's sexual health experts.
It's really important that people know their status. You can actually live with HIV for up to 5 years without experiencing any symptoms. So again, it's really important that people know their status, and that way they're protecting themselves and their sexual partners.
Today, testing takes just minutes.
Okay.
Hi, I'm Liz Kendall and I'm the MP for Leicester West. And I'm here today at Trade Sexual Health as part of HIV Testing Week. I have just had a rapid HIV test, and I just want to encourage as many people in Leicester West and right across the city, come and have your test. It's simple, it's easy, and they are so friendly and open here. It made me feel really, really comfortable. So get your test done. It's really important.
Damon, BBC Radio Leicester.
And a very good afternoon to you as well. Now, next for this afternoon, the government has pledged more than £23 million to end HIV infections in England by 2030. The funding, which was announced to mark World AIDS Day, bolsters an existing goal to achieve zero new infections and HIV-related deaths by the end of the decade. Well, meanwhile, people who have HIV or take medication to protect against it will be able to apply to serve in the armed forces for the first time. And Leicester's Trade Sexual Health, a service of remembrance, is being held today. Delighted to say that Christian Nichols from Trade joins me now. Christian, thank you so much for your time. I mean, first of all, just tell me, what have Trade been doing today to mark World AIDS Day?
Hiya, well, we have an event today called Red Ribbon or Remembrance Day, and that's just to remember all those, regardless of their identities, so LGBT, and also those who identify as heterosexual, just to really remember them and their lives.
And Christian, why is it so important to mark World AIDS Day?
It's really important, personally, I think, because obviously for my generation, AIDS hasn't really been an issue, but it's more so the generation before me. So it's really important to keep the conversation going about what happened during that time. And not so much in England, but in places like sub-Saharan Africa, AIDS and HIV is still a pandemic in those kind of countries. So it's really important to keep the conversation going and to also let people remember that although medication advances are available within this country to the masses, they aren't necessarily available to all those who are HIV positive. And again, just to also elaborate that during the pandemic itself, in terms of those who identify as gay and bisexual, we literally almost lost a whole generation during that time. So again, it's really important to remember those who have passed.
And Christian said then about, always remembering those who have passed, to keep the conversation going, to keep raising awareness as well. I mean, a huge funding announcement from the government today. I mean, what does that mean to you?
It means that the conversation is going to be going. For me, there's a term called U equals U, undetectable means untransmittable. That means somebody who is someone who's HIV positive and is on effective medication, it's actually impossible for them to pass the virus down to somebody else. And amongst the general public, people don't tend to know that. So I really think this part of money is really, really important to raise the awareness on where we are now with HIV. It's a Sin was an amazing program. It really put a spotlight in what happened during the 80s and 90s. However, I really feel as though it really lost an opportunity to educate the masses on where we are now with HIV. So hopefully this money is going to help create awareness, but also accessibility and also exposure to people, because I think a lot of people aren't exposed to information. I think within the LGBT community, I think because the pandemic predominantly hit us, we have always been exposed to campaigns around HIV and AIDS and using condoms and stuff like PrEP as well. But the average Joe Blogs on the street probably doesn't know what PrEP is, probably doesn't know what U equals U is. So I really think that this is a perfect opportunity for them to spend the money wisely and really get that awareness out there, so people across the board know that, again, someone who's on effective treatment, it's impossible for them to pass on the virus to somebody else, because there's still a stigma around those who are living with HIV. So I think this money is really important, again, to raise awareness and to really educate people on where we are now with HIV and how it looks now. It's not the death sentence that it was in the 80s and 90s.
And what does it mean as well, Christian? You know, hearing that £23 million, raising awareness, you know, kind of not missing tricks, making sure that people are educated, I guess is what we're saying here, educated, informed, so they've got the full facts. What about the fact that an employer as big as the Army has made that announcement today that people who have HIV will take medication to protect? You said about PrEP there as well. I mean, what does it mean? What does that mean that they've come out and made that statement today as well, Christian?
It means that they've come up with the times. So in terms of somebody being U equals U, again, undetectable means untransmittable. That term has been around for years and years, and it's been a known fact that someone who's on effective medication can't pass on a virus to somebody else. So I think that it's great news, but I think that it could have been announced earlier, to tell you the truth. But again, it's great that these things are happening now, but I wish that we were at this stage maybe 10 years ago. And again, it helped to kind of eradicate the stigma of someone living HIV, because fundamentally, beforehand, that was saying that if you're positive, you're not healthy enough to serve for this country. So again, you're actually encouraging the stigma against those who are living with HIV.
Christian, thank you so much for your time this evening. Just tell me...
One more thing. Can I say one more thing? So it was actually Leicester HIV Testing week last week, and we want people to practice safer sex. There's no such thing as safe sex. The only way to have safe sex is not to have sex at all. So how do you practice safe sex? First of all, use some kind of barrier, whether that be a condom, a femidom, or a dental dam. Number 2, get tested and know your status. And that's how somebody has safe sex. So get tested, use a barrier, whether that's a condom, and also educate yourself around PrEP. And again, there's no such thing as safer sex. You can only have safer sex. So we need to be realistic when we're talking about sex.
Christian, thank you so much for your time. You're genuinely welcome on the show anytime at all. Thank you so much. The incredible Christian Nichols there, joining us from Trade, Leicester's Trade Sexual Health, telling us more about World Day. Well, wasn't that great to get Christian's viewpoint on that, you know, and get his reaction to that as well. Christian Nichols from Trade joining us this afternoon here on BBC Radio Leicester.
Hi, I'm here at Trade Sexual Health Services in Leicester. Trade are a brilliant organisation who provide HIV testing, who hand out safer sex kits, who provide counselling and support. And I'm here to take a HIV test as part of Leicester's testing week, because we know that here in Leicester that that late diagnosis for HIV is worse than other parts of the country. And although HIV need not be the death sentence that it was, say, 30 years ago, with great advances, that there are still many people living with HIV, and there's still many people with undiagnosed HIV, and we really want to deal with the stigma of people not getting a test. So I, as the Leicester Health Secretary, I'm going to get tested now, but people in Leicester and Leicestershire, please get a test. It really, really is important, and I'm delighted to show my support and solidarity to Leicester Testing Week once again.
Is that okay, by the way?
Yeah, that was fine. It was fine. As you say, it's always the anticipation, isn't it? Well, it's really important that, as you say, that we really promote this in Leicester to our statistics. So thank you very much.